I get goosebumps thinking about how we can impact a patient's life. When I was a younger clinician, I had a patient and she was older and she had been recommended by others to go on to hospice. And she had been misdiagnosed. They thought she had breast cancer, she actually had ovarian cancer. And when I met her, she was in her 80s and she said, I've lived a good life and it'd be okay, but I'll take the clinical trial. Well, we treated her and she did incredibly well. She had a complete remission. Her cancer went away. And I would get a letter from her. I would see her and I still get letters saying, I need to thank you because I celebrated my 60th wedding anniversary. I just watched my 18th grandchild graduate from college. And so I need to think in those important landmarks, the reasons we live. And that's really what motivates me in the clinic. I think the next decade has so many good things to offer because we're learning, for example, ovarian cancer is not one disease. We know ovarian cancer is multiple diseases we've lumped together because they all kind of start in the same place, but they're different. And so each one of those diseases needs to be treated differently. And we need to be able to study subsets of disease. And now the new excitement is immune therapy. And immune therapies still aren't working great in gynecologic cancers, but we're going to change that. So they've been game-changing in things like lung cancer and thyroid cancers. Other cancers like melanoma haven't worked as well in ovarian cancer, but we're starting to understand why. And so based on this, there's a lot of excitement, I think, definitely in our lab, but in the field as we try to find ways to make immunotherapies work in patients with gynecologic cancers. In fact, our next clinical trial is an immunotherapy trial, which started in our laboratory, was funded by patients and philanthropy, and we've now moved it into the clinical trials, and we should get NIH funding soon, and we will start enrolling our first patient this week. I'm honored to receive the PNC Elsie Hillman Distinguished Scholar Award, and I would like to thank PNC and Lou Cicello for their support.